male child has episodic anemia and jaundice since birth, which one of the following is the least likely cause? Sickle cell anemia is the answer. Why? Clinical manifestations of sickle cell disease are not present at birth and usually begin to become apparent after the first few months of life as the concentration of HbS rises and HbF declines. Typically, after 6 months, HbF almost disappears and only HbS remains. Jaundice at the time of birth makes the diagnosis of sickle cell anemia the least likely among the options. What does a dotted line show in the illustration of juvenile patient serum immunoglobulin levels? Let's take a guess. So the answer is maternal and fetal IgG. A in the given image represents maternal and fetal IgG. Maternal IgG can be transferred from mother to fetus, that we know. The fetus post-birth has maternal immunoglobulins in circulation until 6 months of age. So now we know that until 6 months, that is marked here, between birth to 1 year until 6 months, is your maternal IgG. In a child, an examination of the CSF is not useful for the diagnosis of Hodgkin's lymphoma. In a child, CSF examination is not used in the diagnosis of Hodgkin's lymphoma. In a case of Hodgkin's lymphoma, there is no CSF spread or highly unlikely, so CSF diagnosis is not used. So, what do you, in Hodgkin's lymphoma, in a child, you do not do CSF analysis. So, let's take a guess. Histiocytosis X. Histiocytosis, also referred to as Langerhans cell histiocytosis and formerly called histiocytosis X, represents a group of rare disorders involving clonal proliferation of Langerhans cells, which are resident macrophages in the dermal tissue. The condition is characterized by abnormal proliferation of Langerhans cells and can affect multiple organs, including the skin, seborrheic dermatitis, respiratory system, like sinusitis, chronic ear infection, and cause failure to thrive. HS. megali and exophthalmos. Light microscopy shows cells with coffee bean nucleus. Electron microscopy shows tennis racket shaped granules. So, light microscopy, coffee bean, electron microscopy, uh, tennis racket. What is your diagnosis? Histiocytosis X. Which of the following is the maximum steroid produced by the fetal adrenal glands? Let's take a guess. DHEAS. The steroid produced maximum in quantity by fetal adrenal glands is DHEAS. The fetal adrenal gland is formed around 8 to 10 weeks time. Initially, the glands produce cortisol, which acts to suppress ACTH formation from the pituitary. During this phase, the gonadal development takes place in males and females, is taking place, and such an action is necessary. In the second trimester, cortisol production decreases and DHEA and DHEA sulfate are produced in large quantities. The placenta uses this for the production of estrone and estradiol. In the third trimester, again, cortisol production is increased, but the hormone produced in maximum quantities stays DHEAS. And the answer is CAH. Congenital adrenal hyperplasia is a type of abnormality in sexual development which has the best prognosis. It is possible to treat congenital adrenal hyperplasia by giving the body enough glucocorticoids to stop the overproduction of androgens. Surgery can be done to treat the genital abnormality like enlarged clitoris, fusion of labia minora. The prognosis has improved as a result of efforts to treat CAH in pregnancy and newborn screening techniques to detect it. CAH patients have become pregnant and give birth to healthy children. So, best prognosis is CAH. Which medication is best for treating congenital adrenal hyperplasia caused by 21 alpha hydroxylase deficiency during pregnancy itself? Let's guess. Answer is dexamethasone. Drug of choice for prenatal treatment of congenital adrenal hyperplasia to 21 alpha hydroxylase deficiency is dexamethasone. Other steroids are deactivated. Only dexamethasone can be used. A diabetic mother delivered a baby whose blood glucose is 60. What other investigation does the nurse anticipate the doctor would have her conduct? Answer is serum calcium. So, babies of diabetic mothers are prone to metabolic irregularities than those of non-diabetic mothers, including hypoglycemia, hypocalcemia, and hypomagnesemia. So, less glucose, less calcium, less magnesium. Ventriculoperitoneal is the most frequently used.